Welcome back. In this video I want to introduce you to the balance. Now, I want you to imagine a set of scales or a balance, and now imagine your thoughts and emotions and feelings are in the pans of that balance. So on the one side, in one pan, we've got our emotions and feelings, and in the other side, on the right, we've got our thoughts and our thinking. Now, normally on a day-to-day basis, our feelings and thoughts tend to be roughly in balance. And usually they don't tip too much one way or another when nothing particular is happening. Now, sometimes we can get really focused on doing something and our feelings and emotions recede into the background. And the more focused we get, the more the emotions and feelings recede. So, for example, when I'm writing, quite often I get so focused that when I finally look up, I suddenly realise that I've been sat still for hours. My legs have gone numb, I haven't had anything to eat or drink, and I'm freezing. And the moment that I start to think that, all emotions and feelings suddenly start to flood back again at that moment. And of course, the opposite can happen. Well, we got so caught up in emotion, our ability to be able to think straight reduces considerably. Now, this can happen for both positive and negative reasons. For example, when people fall in love, quite often their ability to see the situation rationally takes a dive, and quite often they can end up doing quite embarrassing things that they wouldn't normally do because of the height of the emotion. And similarly, if we get into a panic about something, we can't actually think straight, and the emotions start to spiral upwards. Now, the intention here and the intention of the balance is to be able to get back into balance or rebalance as quickly as possible, and at any rate within a few seconds. And I'm going to show you how to do this. But before I do, there are kind of three principles for rebalancing. The first one is that it's very difficult to focus on two things at the same time. If you're focused on doing something, you're not focused on your emotions, and vice versa. You've probably had the experience of being anxious, and then something happens and you've got to go and deal with it. And when you finish dealing with it, you realise you aren't anxious anymore. And when the moment that you feel you aren't anxious, what happens? Yep, the anxiety comes back. Now, hospitals and medics are using this, what we call unimodality, the fact that we can only really focus on one thing, in things like casualty units. One of the problems, for example, in burns units is that when they change people's dressing, it's excruciatingly painful for the individual who's having the dressings changed, and particularly if the burns cover large parts of their body. Now, because of this process that we can't actually focus on two things at the same time, what they've done is they've developed a virtual reality headset. And in the virtual reality headset, they put it on the patient, is a game. And you control the game with your eyes, entirely with your eyes. And the game's about some penguins sliding down a glacier. And your job is to knock over polar bears. Not very fun for the polar bears, I suppose. Anyway, so they put the headset on the individual and they get them so that they can control the penguin, and they get them focused into the game. And once they're focused into the game, they're able to change the individual's dressing without any anaesthetic, because all of the modality is taken up and there's no pain. The person doesn't register any pain because they're so focused on moving these penguins and hitting the polar bears. Now, the second principle is that it's easier to increase something than reduce it or stop something. So, for example, if you try to focus on your emotions and try to reduce them, what happens? Usually they get stronger. So it's easier to increase your focus on thinking about something else than try to reduce the emotions. So focusing on reducing the emotions doesn't actually work terribly well. but actually moving your focus outside and thinking about something and focusing on something will automatically, because it brings the thoughts and the thinking up, bring down the emotions and feelings. And the last principle, and I think this is just genius, I think it's genius because I came up with it, is that you can't be both relaxed and anxious at the same time. If you're anxious, you can't be relaxed, and if you're relaxed, you can't be anxious. And I know which one I would rather be. So what I'm going to do now is I'm going to show you some techniques for using these principles. And these are what we call distraction or focusing techniques, and they're really good for low-grade anxieties. They can cope with larger ones, but we've got some other techniques for those. So distraction techniques, simple techniques that really quickly, things like puzzles or anything else that you have to focus on to complete, can help to just reduce anxiety. And if you use this as a habit, what happens is the anxiety gets less and less and less. And we talked about this and about the power of dishabituation. And you can use a distraction technique in order to dishabituate an anxiety. Other things are things like mobile phone games, or focusing on something nice on a mobile phone, especially with some of the apps that we have. Or a very simple one, especially if you're sat there waiting for an interview or something like that and you're starting to feel anxious, is just to start to count backwards from 100. So what I want you to do is I want you to try some of these and notice what happens. The more that you focus, you'll start to notice that that the anxiety will go. The other thing about distraction techniques is you can create your own. So a professor that I worked with not so long ago, what she does is she used to get quite nervous waiting to go up to present papers. And she developed quite a neat distraction technique while she was just sat there waiting, because she couldn't do anything like get a mobile phone out, because that would be being seen as rude, especially from a professor while somebody else was presenting their paper. So what she does is she gets a notepad out, so she looks like she's taking notes, and then she mentally goes through the cupboards in the kitchen at home to work out what food she's got in the cupboards in the fridge, and then she works out a meal plan for the week, and then, having gone through the cupboards mentally in her head, she tries to work out what she's going to have to get from the shopping on the way home. And so while she's doing this, she's not focusing on the emotions, and she can get up and just start quite normally. Another thing which is very powerful, and you're about to experience it, is guided imagery. So I'm going to take you through a guided imagery. And what I'd like you to do is I want you to notice this working. So I want you to start to think about something that when you think about it, it starts to make you nervous. So something you wouldn't want to do, for example, whatever it happens to be that would make you start to feel nervous. Great. So once you've got something, I just want you to sit down and just relax. You can close your eyes for this if you want. And I want you to go back to a time. You know those moments when you're with some people and you start laughing and then you realise you can't stop laughing? And in fact you end up laughing so much it hurts. I want you to go back to a time when that happened. And I want you to remember what happened, in what order. So how did it start? And who else was there? And I want you to just remember that feeling of helpless laughter. That's right. And where exactly were you when it happened? And if you're inside, what was the decor of the room like? And if you were outside, exactly where were you and what was going on around? Were there any other people present that weren't laughing? And what were you wearing? Well, if anything, of course. And what were other people wearing? And what was the weather like? and then just go back to that feeling of helpless laughter and what it actually felt like, hardly being able to breathe but laughing so much. And then when you're ready, just open your eyes and notice how you're feeling now. And that took probably less than a minute. And you can use that one or any other pleasant kind of memory that you've got. And the thing is, because it's private and in your head, nobody can see it. So it can be any memory that you like. And the thing to do is to go back to the memory and get as much detail as possible. Because the more you focus on the detail, the more you move away and you start to rebalance. So the pans start to become equal. And in fact, actually what it does is it replaces the negative emotion of the anxiety with the positive emotion of things like laughter or having a nice time or whatever it happens to be that you had. So what I'd like you to do is I'd like you to go out and find some distraction techniques and try the guided imagery technique that I've shown you, or create your own one and start to use it when you start to feel anxious. And the more you use it, the better it'll get. So have a go, and I'll see you on the next video. Take care. Bye.